I'll be teaching you about pharynx today. About pharynx, we'd first go about the general introduction, a bit about the dimensions of the pharynx, the various parts that you have. Further, we'll go into the structure that forms the wall of the pharynx, the muscles of the pharynx, also the relations of the different parts of the pharynx. And finally, we'll tell you about the blood supply, nerve supply, lymphatic drainage, and a bit about the applied anatomy. Coming straight away to the diagram over here, I have more of the diagram to describe you what pharynx is. So pharynx is basically a muscular tube for the passage of both air and food. I repeat, it's a muscular tube for the passage of air and food. And in this diagram, you can see over here the pharynx extending from here right up to here. Okay. Now, it's for the passage of air and food. Okay, the upper part is just for the air, and this is lying behind the nasal cavity. The mid part of the pharynx is both for air and food, and the lower part is again for the passage of the food only. So let's first define the dimensions of the pharynx. I told you it's a muscular tube and it's extending right from the base of the skull. If you look at this diagram over here, this is the base of the skull formed by two bones. Okay, the sphenoid, which is over here, the body of the sphenoid, and the occipital bone. Together we call it as basisphenoid. So this is the roof of the pharynx. It starts from here. And it extends right up to, I'll go to the another diagram. Yeah, in this diagram you can see starting from the basisphenoid, from the basilar part of the occipital bone and the sphenoid, right up to the C6 vertebra, as you can see in this diagram, the C6 vertebra. And this is corresponding also to the lower border of the cricoid cartilage that you can see over here, the lower border of the cricoid cartilage. So I would like to further modify my definition of pharynx, that it's a muscular tube that runs from the base of the pharynx up to the C6 vertebra, or the lower border of the cricoid cartilage. And if you go further on, so this whole length is around 12 centimeters. So it's around 12 centimeters in length. It might vary with age, of course. And the upper part is the widest part. It's around 3.5 centimeter in diameter. The mid part is narrower, and the lower part is the narrowest. Now, I would not be using the word upper part, mid part, and lower part. Let's go to the parts of the pharynx. Okay. The part of the pharynx that lies behind the nasal cavity is called the nasopharynx, as can be seen over here. And the part that lies behind the oral cavity, this is the oral cavity, is the oropharynx. And finally, the part that lies behind the larynx is called the laryngopharynx. Okay? So the pharynx is widest in its upper part. It's widest in its upper part, the nasopharynx, where it is 3.5 centimeter. And it ends at laryngopharynx, where it continues further as the esophagus. So the pharynx continues as the esophagus, and further it goes on to be the stomach, the duodenum, and the small and the large intestine. So anyway, coming back to the three parts of the pharynx, once again, the part behind the nose is the nasopharynx, the part behind the oral cavity is the oropharynx, and the part behind the larynx is the laryngopharynx. Let's first define the boundary of the pharynx in totality, then we will talk about the nasopharynx, the oropharynx, and the laryngopharynx, and the various structures. Okay, the boundary, if you see over here, right, I told you it starts from the base of the skull, which is the basisphenoid. So superiorly, it is the base of the skull formed by the basilar part of the occipital bone and the sphenoid bone. Inferiorly, it extends up to the C6 vertebra and the lower border of the cricoid cartilage. Anteriorly, if you look, the boundary is deficient. Okay, so there is the nasal cavity, so there is the posterior nasal aperture, which we also call as the CONAE, C-H-O-A-N-A-E, the posterior nasal aperture. And then you have the oral cavity, so there is a opening over here, or there is a gateway which we call as the oropharyngeal isthmus. Okay, so anteriorly you have the oropharyngeal isthmus, the posterior nasal aperture, and then you have the laryngeal inlet where you enter into the larynx and the posterior wall of the larynx. So this is the anterior boundary. The posterior boundary is bounded by, as can be seen in the diagram, all the vertebrae, right from C1 to the C6. They form the posterior boundary covered by the prevertebral muscle and the prevertebral fascia. So this forms the posterior boundary. Coming to the lateral boundary, that's a little more complex to understand, but I'll go back to an image. Yeah, if you can look in this diagram, this is the lateral boundary of the pharynx, is shown over here. And this would constitute of the medial pterygoid plate along with the hamlus, the projection. There is the mandible, and there is a fibrous band which we call as the pterygomandibular raphe. So the medial boundary is the medial pterygoid plate, the hamlus, the pterygomandibular raphe, the mandible, the mylohyoid line, the tongue, and further down you see the hyoid bone, the thyroid cartilage, the cricoid cartilage. So these form the lateral boundary. You also see structures like those coming from the styloid process, what we together call as the styloid apparatus, the 3 muscles and the 2 ligaments. So those are the lateral boundary. You have some vascular structure, the internal carotid artery, the external and the carotid artery, and the branches of the external carotid artery. So they all would come under the lateral boundary of the pharynx. Okay, so let's go back to the nasopharynx first. This is the nasopharynx, and again I would like to use this diagram to explain you what exactly you see in the nasopharynx. So when we talk about the nasopharynx, the roof of the nasopharynx is formed by the basis sphenoid. The anterior part, anterior boundary is by the posterior nasal aperture. The posterior boundary here is just the C1 vertebra. We have the posterior boundary of the pharynx from C1 to C6. So you can basically remember C1 is for the nasopharynx. The posterior boundary of the oropharynx is C2, C3, and C4, C5, C6 for the laryngopharynx. So the posterior boundary of the nasopharynx is the C1 vertebra, which you all know is the atlas vertebra. Okay, that's forming the posterior boundary along with the prevertebral muscle and the prevertebral fascia. Okay, inferiorly you have the nasopharyngeal isthmus, beyond which we have the nasopharynx. So this is the inferior boundary, the nasopharyngeal isthmus. What is important to remember is the lateral boundary of the nasopharynx, and you see a lot of structures over here. You can see an opening over here, and this is the opening of the eustachian tube. It's the opening of the eustachian tube which is connecting the nasopharynx to the middle ear cavity. Just behind the opening of the eustachian tube you see an elevated portion. Okay, it's bounding the eustachian tube opening above and behind, and this elevation is called as the tubal elevation. It's called the tubal elevation. It has a collection of lymphoid follicles which we commonly call as the tonsils, and this tonsil would be referred to as the tubal tonsil. So you have the eustachian tube opening, the tubal elevation with the tubal tonsil. Behind it there is a fossa, depression, which we call as the fossa of Rosenmuller, the fossa of Rosenmuller. So these are the important structures, and if you look at the tubal elevation, it's going downward, and this is nothing else but a muscle going from the from the eustachian tube down to the pharynx, which we call as the salpingopharyngeus muscle, the salpingopharyngeus muscle. So this would go down, and this is covered by a mucosal fold, and this fold is called as the salpingopharyngeal fold. Coming to the most important part over here at the junction of the roof and the posterior wall. If you look over here at the junction of the roof and the posterior wall, there is another localized collection of lymphoid follicles. Any such localized collection of lymphoid follicle is referred to as tonsils. So this tonsil is called as the pharyngeal tonsil. And where is it located? At the junction of the roof and the posterior wall of the nasopharynx. So you see the pharyngeal tonsil. This tonsil, when pathologically enlarged, is referred to as a condition called as adenoid. And sometimes the enlargement is such big that it might just block the posterior nasal aperture, and that leads to a lot of problem in breathing. The patient comes with a history where you can see you can actually identify the patient, because the patient is a small child generally, because these tonsils are mostly enlarged at young age children. So it's a child coming with a typical facies where there is a flattened nose, the child is a mouth breather, the tongue protruding out, so that's the adenoid facies. So you should immediately suspect adenoid, which is the pathological enlargement of the pharyngeal tonsil, which is located at the junction of the roof and the posterior wall of the nasopharynx. That's about the nasopharynx. Coming to the oropharynx. The oropharynx, well, anteriorly you have the oropharyngeal isthmus, superiorly you have the nasopharyngeal isthmus, inferiorly it extends up to the upper border of the epiglottis. So up till here you have from this oropharyngeal isthmus to the upper border of epiglottis, you have the oropharynx. So superiorly you have the oropharyngeal isthmus, superiorly you have the nasopharyngeal isthmus, posteriorly you have the boundary, you have the C2 and the C3 vertebra along with the prevertebral muscle and the prevertebral fascia. Finally we come to the laryngopharynx. This is the lowermost part and the narrowest part, and the anterior boundary is formed again by the laryngeal inlet, and the posterior wall of the larynx, where you can see the cartilage, the cricoid cartilage, the lamina of the cricoid cartilage over here, and above it you have the arytenoid and the corniculate and the cuneiform cartilage lying over here. So these are forming the anterior wall. Anterior wall above is formed by the laryngeal inlet. Okay, and so these are the boundaries. Inferiorly, I told you it's up to the C6 vertebra. So that's about the pharynx's boundary. Now, what is the structure of the pharynx from inside to outside? The innermost layer of the pharynx, as you can see in this diagram over here, is the mucosa. Inner layer is always the mucosa, and after the mucosa you have the submucosa, not shown in the diagram, and then you have the muscle layer. Mucosa, submucosa and the muscle layer. But what's very typical is that the muscle layer is bounded by a fascia, both on the inside, which we call as the pharyngobasilar fascia, and on the outside, that we call as the buccopharyngeal fascia. Okay, so if we talk about the layers of the pharynx, so it's the mucosa, the submucosa, the pharyngobasilar fascia, the muscle layer, which are two in number, first the longitudinal muscle layer and then the constrictor muscles, and then the outermost is the buccopharyngeal fascia. So remember, the outermost is the buccopharyngeal fascia that you see. Now coming to the constrictor muscles of the pharynx, there are three constrictor muscles of the pharynx, the superior, middle and the inferior constrictor muscles. Okay. The origin and insertion. The origin is a bit complex. The insertion is all the muscles, they start from the front. Okay, they come from the front and they insert on the posterior wall of the pharynx in the median line, midline, which is called as the medial pharyngeal raphe. Okay, so you can see in this diagram the median pharyngeal raphe where it's inserting. So let's first start with the superior constrictor. It's starting, the origin is vast, starting again from the medial pterygoid plate, the hamulus, and you can see this pterygomandibular raphe running from the hamulus to the mandible, from the pterygoid process to the mandible, so we call it pterygomandibular raphe. So from the medial pterygoid plate, the hamulus, the pterygomandibular raphe, the mandible, part of the tongue, the mylohyoid line. Okay, so this is the origin of the superior constrictor. It goes backward and inserts. Insertion is always the same. The median fibrous raphe. Very quickly, I'll finish off with the middle constrictor, and then we'll move on in the next class. So the next muscle is the middle constrictor of pharynx, which extends from the lower part of the stylohyoid ligament. Okay, the coronu, lesser coronu, and the greater coronu of the hyoid bone, and it inserts into the median fibrous raphe. And the last is the inferior constrictor. Inferior constrictor, you need to know, is just two of them, one starting from the thyroid cartilage, from the oblique line, and one from the cricoid. The one arising from the thyroid cartilage is called the thyropharyngeus, and that arising from the cricoid cartilage is called the cricopharyngeus. Insertion again is the median fibrous raphe. So that's about the constrictor muscles of the pharynx, and further on we will talk about the blood supply, nerve supply, lymphatic drainage in our next class. Thank you very much.